treating infertility, we always have to look at every single factor that's within our power to modify, to optimize, to help improve chances of success, to help patients conceive and grow their family. So, one of the most commonly overlooked factors to support reproductive health and reproductive outcomes is usually dietary patterns. And I feel, in my experience, this is something that very few patients have had any conversation about with their healthcare provider. So oftentimes they're left to Google or online resources that they found, which may not have the same scientific validity as research, clinical trials, or reviews, systematic research, meta-analyses that help us to have a more accurate understanding of what dietary changes, if any, actually impact fertility. And over the years, it's become very well established that there is a very strong connection between the types of dietary pattern one follows in their life and certain nutrients, and how that can either positively or negatively affect reproductive outcomes. And specifically, there was a new review published, a new trial published recently in the Hospital of Massachusetts, and they basically followed a number of couples that were going for assisted reproductive technologies such as IVF, in vitro fertilization, and they followed specifically a one particular nutrient, which was omega-3 fatty acids. So omega-3 fatty acids were measured, if they had lowest, medium, or highest, and they actually divided up into what we call quintiles, so by fifths. So who had the highest intake of omega-3 fatty acids that were in the top 20%, and so forth. So what they found was actually quite interesting, and this was a prospective cohort study, so we're establishing what's called correlation here. So we can't establish causation, but nonetheless, the findings were quite interesting. And what they found was specifically patients who had more omega-3 fatty acid consumption through their diet were actually much more likely to get pregnant with assisted reproductive technologies. And additionally, they were actually at a lower risk for miscarriage. So they saw a higher live birth rate, which is really the main reproductive outcome we want to look at when we're discussing fertility treatments. It's a live birth rate. How many of those patients go on to give birth to a healthy live infant? So live birth rate is actually more valuable to us as a reproductive measure than, for example, pregnancy rate. And so this was quite valuable in that they observed that just by having more omega-3 fatty acids in the diet, it was associated with an increased live birth rate, lower miscarriage rate, and a higher pregnancy rate as well. Similarly, for sperm parameters, they actually found having more omega-3 fatty acids was associated with increased sperm concentration and sperm motility, which I think often comes as a surprise for a lot of patients, because they're often told that they can't do anything about their sperm concentration or motility. That a lot of the patients, unfortunately, have this belief, which I think is in part related to the way the results are communicated to patients, that they're kind of set in stone and there's really nothing that can be done about them, which we see is actually not true, where we see patients who have significantly modified sperm concentration, motility, morphology, reducing DNA fragmentation rates just through lifestyle, dietary changes, among other interventions that are fairly non-invasive. So when we're looking at the big picture of things, omega-3 fatty acids are suggested to play a significant role in supporting reproductive outcomes. And this isn't the only study that's been done about omega-3s. There's a wide range of studies out there looking at how omega-3s actually have a very strong immunomodulatory effect. They can affect the immune system, they can modify it, they can actually lower inflammation in the body as well. They may have a role in reducing oxidative stress, the oxidative or chemical stress that is actually quite harmful to both eggs and sperm cells. So we're still learning about how this specific nutrient has an impact on reproductive outcomes. And this study in no way tells us 100% that the outcomes we saw were a result of the omega-3s, but it's kind of pushing us towards that direction where we want to see more research on this topic now. And when we look at the risk of using something as simple as omega-3s, it has a very high safety profile. So it's definitely worth speaking with your licensed naturopathic doctor, your fertility doctor, or your family doctor about using omega-3s as an adjunctive treatment to help potentially support outcomes with something like IVF or intrauterine insemination. And this isn't a generalized rule that it's safe for everyone. There are certain medications we want to be careful. If you're taking, we might not want to give omega-3s if there's certain health conditions present, that or contraindications we call them. We wouldn't recommend taking additional omega-3s beyond what you might get in your day-to-day diet. So it's definitely something that needs to be discussed and supervised with a licensed healthcare provider to make sure it's actually appropriate for you. But nonetheless, I think it's really great to see research like this and sharing it with patients or individuals who are currently trying to conceive or may unfortunately be struggling to conceive, to help understand that there's actually more out there from an evidence-based perspective that can actually impact your chances of conceiving.